Imagine the public's reaction and response if greater than 50% of cancer patients were diagnosed at stage 4 or 5, when there were warning signs or indications of cancer in their medical records at earlier stages. There would be a major uproar. Essentially, this is what's happening with kidney disease. But we are going to connect some dots to show you how the power is in all of our hands to change the status quo and to save kidneys and lives. Nearly 37 million American adults have kidney disease, yet 90% don't even know it. Like cancer, there are 5 stages of kidney disease. Stage 5 is kidney failure, where dialysis or a transplant is required for survival. But if caught at earlier stages, it can be stabilized or even reversed. Yet 1 in 2 people with very low kidney function at either stage 4 or stage 5 who are not yet on dialysis don't know that they have kidney disease.
I was a part of that 90% that didn't know when my kidneys failed 22 years ago at the age of 29. It was a year after I had gotten out of the Army, and Analyn and I had only been dating 3 months when I developed a bad cough. After a week of her suggesting to go to the doctor, I finally did, thinking I had bronchitis and they would give me some antibiotics and send me on my way. I'll never forget the look on the nurse's face when she took my blood pressure 3 times before running to get the doctor, who informed me that my blood pressure was 270/190 and they had called the ambulance. By the time I reached the hospital, my blood pressure was 300/200, and the ER doctor was asking, "Didn't you have a headache? You could have had a stroke. Didn't you have chest pain? You could have had a heart attack." "Nope, just that cough." Then he proceeded to tell me that my kidneys had failed and they needed to start me on dialysis right away. Whatever he said next was a blur, because all I could think was, what the hell is dialysis and how long do I have to live? A week or so later, when Analyn picked me up to take me home from the hospital, I told her I was going to move from Phoenix back to Charleston, South Carolina, because I knew I had a long road ahead of me, and she was too young, and it wouldn't be fair to her to have to take this on. Thankfully, she quickly replied that I didn't need to go anywhere, that I was a great guy, which I am, and we should see where our relationship goes. I was hoping she would stay with me, but I had to give her an out. We were married less than a year later and have continued to step forward arm in arm with every challenge that has come our way.
Would it surprise you to know that kidney disease kills more people each year than breast cancer or prostate cancer? You would not be alone. If you were to ask a 5-year-old what the pink ribbon stands for, most would be quick to say breast cancer. Yet most adults would be hard-pressed to provide a fact about kidney disease if asked. The FDA collected data comparing 5-year survival rates of various cancers versus the most common dialysis treatments and kidney transplants, and found that the majority of cancers had higher 5-year survival rates than patients on dialysis. Thankfully, Raymond has far surpassed the odds stacked against him, and we are on a mission to change the trajectory of kidney disease and save millions of lives, maybe even yours, through awareness, prevention, and regenerative medicine.
There is such a silence around kidney disease that needs to be addressed. A silence of symptoms, a silence of awareness, a silence that creates misunderstanding, a silence of loneliness, loss of hope, and depression, a silence of and complacency to accept the status quo. High blood pressure, kidney disease, and diabetes often go hand in hand and wreak havoc on the heart and body. I can attest to this. With the exception of my brother donating one of his kidneys to me in 2001 that lasted 5 years, I've been on dialysis since my kidneys failed. 6 months after transplant, the anti-rejection medication caused me to become diabetic. My blood sugar jumped to 1,000 and I became insulin dependent. In addition to high blood pressure taking my kidneys, 10 years later, it also caused a dissection of my aorta that resulted in my having emergency open heart surgery to replace an aortic arch with a graft and put a mechanical heart valve. I realized a long time ago that if I didn't take care of this disease, it was going to take charge of me. I had to make a commitment to eat healthier, exercise 4 to 5 days a week, and have a positive outlook on the future at every twist and turn in my journey. I've been encouraged by advancements in regenerative medicine, that are still on the horizon, and other breakthroughs that are already making a difference, including one that has helped me regulate my blood pressure and reverse my type 2 diabetes. I'm happy to report that after being on insulin 14 years, I'm no longer on any insulin or diabetic medication whatsoever. For the past 8 years, I've benefited from Analyn being able to administer my hemodialysis treatments from home 5 days a week. Thanks to the benefits of more frequent dialysis from home, I have a new lease on life. So much so that back on February 20th, 2016, I was on the stage dancing to Pharrell's song as a celebrity star at the National Kidney Foundation of Arizona's Dancing with the Stars competition. 18 years to the exact day that my kidneys failed, demonstrating that dialysis doesn't have to be a death sentence. But at the end of the day, I'm even more passionate about helping people keep their kidneys and avoid a journey like mine.
If ever there was a time to ring an alarm for kidney disease awareness and prevention, it is now. We recognize that there are several causes, but diabetes and high blood pressure are by far the two leading causes of kidney disease and kidney failure. So let's start there and begin connecting some dots. According to the CDC, approximately 1 in 3 adults with diabetes and 1 in 5 adults with high blood pressure may have kidney disease. Both kidney disease and high blood pressure are known as the silent killers. Nearly half of the adults in the United States have high blood pressure, and only 1 out of 4 of them have it under control. Now let's turn our attention to diabetes, which is the #1 cause of kidney disease. The 2019 International Diabetes Federation Atlas report estimated that of the approximate 463 million adults worldwide living with diabetes, half are undiagnosed. They're predicting that number to rise to 578 million by 2030 and jump again to 700 million by 2045, a 51% increase globally between 2019 and 2045. As the rates of diabetes and high blood pressure skyrocket, kidney disease naturally follows suit. Individually and collectively, we have a choice to just accept predictions as inevitable or challenge the status quo and reverse course. Now that you've heard the sound of the alarm, I encourage you to become your own biggest health advocate to protect your kidneys and overall health. Here are a few simple recommendations that anyone can start with. Be informed and prepared to ask questions at your doctor appointments. Know your numbers. Get a baseline on your blood pressure and blood sugars and A1C. If you have high blood pressure, pre-diabetes, diabetes, or a family history of kidney disease, ask your doctor to get a baseline on your kidneys. They can do this with a simple blood test and urine test. Have your doctor explain the numbers, but also just do some research yourself so that you are fully informed. Drink plenty of water. Eat more of a plant-based diet and reduce or eliminate processed foods. Exercise and maintain a healthy weight, and avoid or limit NSAID medications.
This journey has not been an easy one, but I recognize the many blessings I've received along the way. My faith in my family have been a definitive source of inspiration, hope, and support in my life. I am inspired by the discussions with my 15-year-old son and 12-year-old daughter about how they envision their weddings and the dance routine my daughter and I will perform, which inspires me to take care of myself physically and psychologically. We often talk about how I will spoil my future grandchildren, and I envision a long and fulfilled life with my wife and family. It is my purpose and destiny to be a catalyst for change and help others. I'd be willing to go back and do it all over again.
Yes. So, to learn more, if this has definitely inspired you, would like to learn more information, you can definitely go to our website. We just completed a documentary that will be coming out soon, and you'll be able to learn more, and also can pick up our book by going to 1in9kidneychallenge.com. And you can follow us on Facebook at that same address, 1in9 Kidney Challenge.